everybody. So first I just want to thank the organizers of this conference. They have done a fabulous job, and especially to Sharon, Sherry Barron, Andrea Steege, and Peter Dooley. So what I'm going to be talking about is the work that the National Healthy Nail and Beauty Salon Alliance has been doing to organize and educate nail salon workers about, oh my God, all fancy, about the health and safety issues that they face in nail salons. So I'm going to try to move very quickly because I only have 5 minutes. Basically what the issues that nail salon workers face, it's predominantly or largely employed by Asian American women. These are immigrant women who have limited English proficiency. They do not receive health insurance as part of their work benefits largely, and so as immigrants, they often do not know about worker protection or worker rights issues. They don't know how to navigate through government bureaucracies and systems to receive health care, to be able to issue complaints about the health exposures that they're experiencing or the workplace conditions that they're experiencing. And so one of the major things that we have learned as we've begun to explore this issue more is that the products that they're using in nail salons are chock full of chemicals and toxins that can cause serious harm. The toxic trio, the top 3 that we are most concerned about, are formaldehyde, toluene, and phthalates, which are found in nail polishes, in the glues that are used to put nails on, in the cleaning products, etc. And that these women are being exposed to these chemicals, multiple chemicals, over long extended periods of time. They're working 6 to 7 days a week, up to 12 hours a day. Some nail technicians will bring their work home with them and are bringing these toxins into their household, exposing their children to it. And obviously, being exposed to that level of toxin over such an extended period of time is leading to serious health issues. We've heard stories of women fainting in the workplace, and I think the most heartbreaking stories are of the women who experience miscarriages, have difficulty conceiving, or have infant ramifications because of the exposures to these toxins. And while there is an issue of salon workers and owners not being able to receive proper information because of the lack of translations, because the manufacturers are not disclosing the toxins that are in their products. We also know that within the workplace there's issues of ventilation, ergonomic problems, and other things that are contributing to the types of symptoms and illnesses that these workers are facing. And so as a result, the National Healthy Nail and Beauty Salon Alliance was formed in 2007 by the California Healthy Nail Salon Collaborative, the National Asian Pacific American Women's Forum, and Women's Voices of the Earth. And what we've tried to do is establish a network, essentially, of folks around the country who are working on these issues, who are pushing forward training solutions, programs, local and state legislation that can improve the work conditions of nail salons. So I'm going to talk about 2 specific examples. In California, the California Healthy Nail Salon Collaborative recently partnered with the UC Berkeley Labor Occupational Health Program to begin implementing train-the-trainer programs for salon workers that are culturally and linguistically appropriate, and through this training they have been able to reach, oh no, I only have a minute left. So they've been able to do some trainings for workers. There's a new training that they're trying to do for owners, and that includes a effort to help owners insert or implement greening technologies and solutions within their salons so they can provide safer workplaces for their workers, but then also for the consumers that are coming in. I want to talk a little bit about a program that's happening in Washington State. In King County, the local hazardous waste management program has developed a very interesting partnership where they've actually been able to do these kinds of trainings, again, in culturally competent ways, but also to provide financial assistance to salon owners who are trying to make improvements to their workplaces. Can we, well, I don't have time for the video. There's a video on the website that they just released talking about the introduction of ventilation systems and usages within King County. So there's been a research program that they've done in partnership with salon owners in King County, which is really exciting. And I'm sorry, I can't show the video, I'm running out of time. And so what we've tried to do is compile these kind of local efforts to bring this to the national front. So the trainings that are happening in California is actually being looked at as a model for national training programs that the EPA would be able to implement across the country. We recently, in May of this year, held a Healthy Salon interagency meeting where we brought all of the federal agencies that have some hand in regulating the cosmetics industry and providing for workplace safety to talk about, how we can fill in the gaps that are allowing for toxins to be continue to be included in products in the cosmetics. And then we have researchers on our team that are helping us compile research and fact sheets and reports on cosmetic products that can then be used to educate the public about these issues. So here are some resources on our websites and my contact information.